Psoriasis is a very important papulosquamous disorder from exam point of view. So watch this video till the end to know the drugs of choices for various types of psoriasis. Myself, Dr. Maddineni Srinivas, certified dermatologist from India, discussing derma related topics in my YouTube channel. So these are all the various types of psoriasis. As you can see, I have listed them down. So we'll see in group wise manner the drugs of choices for these respective psoriasis types. So chronic plaque psoriasis, which is also the most common type of psoriasis, it is also called as psoriasis vulgaris. Psoriasis vulgaris, and other types erythrodermic psoriasis. In these two types, the drug of choice is methotrexate. Whereas if you see the third one, that is psoriatic arthritis, in this along with methotrexate, even Apremilast can also be used as a drug of choice. Apremilast can also be used as a drug of choice. And in the next two varieties, that is pustular psoriasis and psoriasis in HIV patients, we are going to use Acitretin. Acitretin is basically a systemic retinoid. It is basically a systemic retinoid. You must know one very important point, that methotrexate and acitretin, which is a systemic retinoid, both of these are category X drugs and they are teratogenic, and so these drugs are not to be used in a woman who is pregnant or also in women who is of reproductive age group without using any contraceptive measures. So in such cases we should avoid these medications, and like for example in impetigo herpetiformis, which is nothing but pustular psoriasis in pregnancy. So impetigo herpetiformis is nothing but it is pustular psoriasis if it happens in a pregnant woman, or erythrodermic psoriasis in a pregnant woman. So in pustular psoriasis, the drug of choice is systemic retinoid or acitretin, and in erythrodermic psoriasis, the drug of choice is methotrexate. But since in pregnant women we should avoid both these medications, so here we are going to use systemic corticosteroids, systemic steroids. Systemic steroids are going to be the number one drug of choice. The number two drug of choice in these patients, in these two types of patients, is going to be cyclosporine. Like for example, I have seen few MCQs mentioning that a pregnant woman having pustular psoriasis or erythrodermic psoriasis is also having some contraindications for systemic steroids. Like for example, she is having blood pressure, or maybe she is having high glucose levels. So in such cases, systemic steroids are not to be given. So then our second drug of choice is going to become cyclosporine. So I hope all of you have understood these drugs of choices, and I will just try to, you can take a screenshot of this and you can save this into your mobiles and you can use this for your future references. And there is one question for all of you. So we have discussed one new drug, Apremilast. So please try to post in the comment below what is the mechanism of action of this medication Apremilast. And if you wish to have more of these, KGF videos, Kirak Goldmine flashcard videos, in the comment section just type DrMSD